Cancer, light-enhanced chemotherapy. A new concept has been developed which offers some potential for an enhanced beneficial outcome of cancer treatment. This treatment is not considered as an alternative or as a complementary treatment, but as an extension of mainstream treatment, in particular of chemotherapy. A booklet has been produced giving the full details and is available from the Cancer Light website www.cancerlight.co.uk. Statistically, some 90% of deaths related to cancer are as a result of metastatic disease. Any technique that promises some reduction in this sad toll needs to be pursued. The booklet offers a new potential technique which, it is hoped, may reduce the rate of spread of cancer cells via the blood circulation system. This video is just a brief overview of the contents of the booklet. The idea is new. When we produce a new idea, it is often the result of combining two or more existing ideas or pieces of information, and that is the case here also. 3 pieces of information have been combined. My own background is technical as an electronics engineer, not as a medically qualified practitioner. Nevertheless, any area of new innovation does require a certain mode of thinking, a certain ability to combine ideas, and so to create something new. I do hope that my ideas will be taken up by medical professionals and researchers. So many people are diagnosed with cancer every year, many thousands every day. And so, if it is possible to find even a small percentage improvement in outcome, survival rates, or to extend lifespan and quality of life, I feel that it is worth the effort to do so. We will all know someone who has suffered with cancer, or we ourselves at some point in our lives will do so. The booklet is dedicated to 2 people, to my Aunt Christine Clayton, who died after a long battle with melanoma, and to a friend, Francis Marston, who died a little over a year following the diagnosis of esophagus cancer. The booklet has a number of sections outlining key pieces of information such as the blood circulation system and the lymphatic system. It is not intended as a reference or textbook, but merely to highlight the key factors in the spread of cancer around the body and to give a background understanding of what the issues are. We must study the blood circulation system in particular if we are to tackle this aspect of the disease. As stated earlier, some 90% of deaths related to cancer are as a result of metastatic disease. That is, when the cancer cells spread from the original site to other secondary sites. It grows and spreads and disrupts the functioning of various organs in the body. I should mention that the information contained in the booklet is quite new and has not undergone clinical trials at this stage, and so it must be taken with a sense of caution. Nevertheless, for those who are willing to understand and to take responsibility for their own medical outcome, it may have the potential for some beneficial outcome for you. I hope that it will. My initial interest in this particular aspect of treatment came after reading an article in the New Scientist magazine about a paper written by researchers at the University of Ulm in Germany. It was found by the researchers that, particularly for cancer cells that are resistant to chemotherapy uptake, that the cells can indeed be induced to take up the chemotherapy molecules at over twice the efficiency of the normal method, using a new approach which seems very straightforward. They used an intense pulse of red light. During the time that the light is switched on, some water is expelled from the cell through the membrane, and when the light is switched off, the water returns into the cell, taking with it the chemotherapy molecules. Using the pulsed light is more than twice as effective than using the normal diffusion process to bring the chemotherapy molecules into the cell. Cells can become resistant to chemotherapy because the membrane will actively expel the chemotherapy molecules, and so, in that case, the chemo becomes virtually useless for that patient undergoing treatment as it is currently practiced. The researchers at the University of Ulm suggest that it would be most effective for the treatment of skin cancer, and you can understand why they suggest this. The reason is simply that the light does not travel very far through the skin. It has a depth penetration of around a centimetre or two at the longer wavelengths of red light, and the near-infrared light too. At the blue end of the spectrum, the penetration is shallow. They describe using a red laser. It may be that they used a laser pointer, which are easily obtainable. It was great that the work was done, and that the effect was shown. However, I feel that there is a need for a follow-up study. For example, does it have to be specifically a laser light, or would a more practical, non-coherent light source have the same effect? I have a sense that a non-laser would work just as well at a given power density. It is necessary to mention some factors relevant to cancer treatment. These are described in the booklet. For example, when the patient is assessed, the staging of the progress of the disease is determined. The staging is given a number between 1 and 4, with stage 4 being at a very serious and advanced progress of the disease. It means that the cancer has already spread from the primary site and is established at secondary sites. At this stage, it can unfortunately be a losing battle to control it. There is hope. There are many new forms of treatment, new discoveries, and new medication in the pipeline. But if you have cancer already, can you wait for these? They may be in the pipeline for several years, years which you do not have. It may not be soon enough for you, or your friend, or relative.